All right, nutrition students, we are ready to do a little micro learning for this week. So this is week 5, and you'll be learning about vitamins and minerals. So I have an old PowerPoint that I want to go over. I'm going to skim through some of the elements because there's a lot of information here that is extra and you don't need. Hold on, I dropped my pillow and I threw out my back, so I need to make sure I have back support. Okay, so we're going to go over our vitamin list and why we need vitamins, and then we're going to go over minerals. If the video ends up being too long, I'm going to make 2 videos and upload them for you. So let's start promptly now discussing vitamins. So vitamins, they don't provide calories, but they are nutrients in the sense that they assist in metabolic reactions. So they are super important in the fuel for metabolic reactions and really making your body more efficient in using up the energy and working on releasing energy. So the definition of vitamins is that it's an organic substance. It's not a macronutrient, but it is necessary in performing metabolic tasks. Okay, so it makes metabolic function more efficient, and it also prevents a deficiency of specific nutrients can cause disease. So for example, we all know that vitamin D is super important. It assists with our bone formation and calcium absorption. And so taking vitamin D, especially if we're not getting our natural, there's a natural chemical in our skin that converts to vitamin D when there's sunlight. If we're not getting any sunlight, it's super important to take vitamin D. So our body may not provide sufficient quantities of vitamin D, and as we age, that continues to become more and more of a problem. So this is why aside from diet, sometimes we need these supplements because it may not be enough coming from your diet. So the function of vitamins is basically they are coenzymes. In other words, in enzymatic reactions, they assist enzymatic reactions to break down or build in the metabolic process. It is also acting as an antioxidant and thus can prevent cancer. Vitamins will help the hormones that are involved in the gene expression of certain things that will keep you healthy. Vitamins are also assisting in the components of the cell membranes and the integrity of cell membranes, and that's super important. Also, vitamin A, like for example, components of the molecule called rhodopsin in the eyes, the role of vitamins is crucial as well. Excuse me. Metabolic reactions such as the enzymes and coenzymes are going to function at full capacity as long as there's specific vitamins that are integral in the enzymatic reaction. The tissue and structural integrity of tissue is also super important due to specific vitamins. So there are specific vitamins that are involved in tissue building and bone building. And then some vitamins like A, C, and E are super important and act as antioxidants. Now, to prevent deficiency diseases, we need to have a certain level of vitamins in our blood. And if the vitamin levels are low, then you're not functioning at optimal level. So this is why vitamins are super important. I personally take vitamins. I'm very interested in knowing a lot about vitamins. And I think if you're going into the healthcare field, you will realize that a lot of diseases can be prevented or improved based on just supplementation, including even simple things, all right? Like, let's go over certain rashes and dermatitis. Let's go over even IBS can be improved with certain supplementation. Joint disease can be improved, as you know, with collagen and taking vitamin D and things like that. All right, so this is why we can prevent certain issues with our tissues, not to pun on those words, but issues with your tissues also require a very close analysis of how is a person's diet, and is the diet sufficient to provide enough vitamins within the food or not. And typically I will tell you that most of the time it's not, and so vitamins are definitely a must. And as we age, our GI system doesn't absorb our food as well, and so therefore vitamin absorption, nutrient absorption from the food is diminished. And so supplementation is also super important. And this is why older people need to get B12 shots, because it may not work by just diet and oral supplementation. Now we have the fat soluble vitamins and the water soluble vitamins. The fat soluble vitamins are vitamin A, D, E, and K. The water soluble vitamins are going to be able to be absorbed in the intestinal cells. So those are easy access, they're absorbed, and they're absorbed by the intestinal cells, and the vitamins will immediately move into that portal system and eventually get transported to where it needs to go, to the cells. So the transport of water-soluble vitamins does not require any assistance of carrier proteins, whereas the fat-soluble vitamins, we have the lymphatic system, which are going to carry the fat-soluble vitamins, because we have chylomicrons. And so these are basically, they enter the lymphatic system, and they're able to transport these fat-soluble vitamins to wherever they need to go. All right, so certain health problems, as I mentioned earlier, are a result of inadequate vitamin intake. Vitamins occur in a wide variety of foods, and so typically fruits and vegetables, high vitamin intake. We already know that we're omnivores, so we do still need specific vitamins that come from meat. So we can also think of fish and fish oil, how beneficial it's, the fat from it. But the vitamins specifically found in the fruits or vegetables may still not be enough if we're not absorbing, and that's why supplementation is super important. So whole foods such as fruits, vegetables, and nuts, as well as grains, are typically where you can get your vitamins. And then the proteins, obviously, there are the plant proteins, but of course, the meat proteins that are healthy fats like fish, and lean meats like chicken are a good way to supplement and get enough protein. Now, let's go over vitamin A. Vitamin A is known as retinol, and it aids in vision, growth, tissue strength, and also your immune system. The preformed vitamin A, or retinol, is also, and provitamin A, is also going to be found in vegetables like carrots, right? We store the vitamin A in our liver, so 80% of it gets stored in the liver. A deficiency of vitamin A can cause compromised vision, compromised growth, reproductive issues, immune system issues, and epithelial tissue, which is found pretty much everywhere. Now, the toxicity is if you get too much. So again, healthy balance. Not all vitamins have this issue, but definitely vitamin A is one of those that if you take too much, it could be quite dangerous. So hypervitaminosis can actually cause bone pain. So vitamin A, hypervitaminosis A, will cause bone pain, dry skin, fatigue, anorexia, even loss of hair, and you can actually injure your liver. Now, as a food source, you can get vitamin A in fish liver oil. As I mentioned, you can get healthy protein fish, but there's the added benefit of fish, and hopefully it's not polluted fish, because then you're taking in mercury and all kinds of other polluted substances. But if you're eating healthy fish, the fish liver oil is amazing. It's got vitamin A. You can also get vitamin A from egg yolk. I know, if you're having cholesterol issues, you worry about that and you eat egg white. But if you're not worried about your cholesterol, you can also get your vitamin A from egg yolk, butter, and cream. But again, the best way to do it and avoid all that fat that is not healthy, the unhealthy cholesterol, and you might as well do the fish liver oil or just take vitamin A capsules. Another way to get vitamin A is the dark green leafy vegetables, the dark orange vegetables, carrots, and certain fruits. All right. Heat and oxygen exposure will reduce the stability. Therefore, it's better to eat it crude vitamins, crude vegetables. So don't, steam the carrots. It's really going to be useless at that point. You need to eat raw carrots to get the vitamins, the vitamin A. This is what it looks like when you're not getting enough vitamin A. Now let's go over vitamin D, super important. Caucasians, people from Northern Europe, who typically genetically, our ancestors didn't get enough sunlight because you live up north. And now, of course, anybody of any race, if you live up north, you're not getting enough sunlight. But genetically speaking, if you're of Northern European descent, you typically, naturally, genetically are more prone to vitamin D deficiency, just so you know. Now, if you are not getting in the sun at all, you are at risk for vitamin D deficiency. So calcium, phosphorus, homeostasis is what you have when you take enough vitamin D. So if you don't take enough vitamin D, you're throwing off your calcium and your phosphorus, and your bone mineralization goes down. Your bones become osteopenic and you have osteomalacia. So you need some exposure to sunlight. People that are at the northern hemisphere are more prone to vitamin D deficiency. Now, vitamin D can cause all sorts of issues, not just bone issues. You can have muscle weakness, cancer increase, coronary heart disease increased risk, hypertensive increased risk, stroke, tuberculosis, obesity, type 2 diabetes, macular degeneration of the eye, neurologic disorders, and even autoimmune disorders are associated with vitamin D deficiency. Even mental health issues are associated now. That's been proven, which is not on this list. Toxicity, if you take too much vitamin D, it's the opposite effect. Fragile bones, you get kidney stones. No, you don't want it that. That is a very painful situation. And elevated blood calcium levels, which can be very, very dangerous. So healthy balance again. Again, where do you get the best food source if you're not taking vitamin D? Is eating the fatty fish, fish oil, fortified foods with vitamin D. But of course, a lot of those foods come from a box, and you got to be careful because some of those foods, although fortified, may be unhealthy because of the fact that there's a lot of additional stuff that we don't want, processed foods per se. All right, moving on. Fat-soluble vitamins are super important, and this is to show you how this sunlight is going to convert what's on your skin. And the small intestine, as well as the sunlight hitting the particular molecule called 7-dehydrocholesterol on the skin, will convert the vitamin D in the liver. It gets converted to D25 hydroxylase. Then it goes to calcidiol, and then it goes to the kidney, and it gets converted yet again thanks to another enzyme called hydroxylase, and it becomes calcitriol. And then the calcium and the phosphate are going to be absorbed at the intestinal level. And at that point, you can have the absorption. So it's a multi-step process to eventually get that calcium and phosphate to the bone. But it all relates to the fact that the sun is going to convert this molecule that's found on the skin to cholecalciferol, which then this enzyme hydroxylase D25 hydroxylase in the liver will convert it to calcidiol, still not the proper vitamin D yet. Another enzyme will then convert it to calcitriol, and that is the active hormone, calcitriol, which will absorb the calcium and the phosphate. Now, again, you can just bypass all of this and take 5,000 units, and then those who have a vitamin D deficiency should be taking 10,000 units of vitamin D. All right, so this shows you the soft bones and how it can cause deformity. Now let's go over to vitamin E. So vitamin E is tocopherol, and this is a wonderful vitamin because it has an antioxidant effect. Everyone knows that vitamin E is great for your skin, immune function, cell signaling, and another interesting thing called selenium metabolism. Didn't know about it? Well, yes, vitamin E is specific for that kind of metabolism. If you have a deficiency, it will create hemolytic anemia in premature infants. Even the myelin sheath on nerves will help transmit the nerve impulse. You can have a myelin sheath disruption, and that can cause issues with nerve transmission. All right, so now what happens if you have too much? Excessive vitamin E, none from food source, but if you do excessive supplemental tocopherol, it may interfere with vitamin K activity and blood clotting. All right, so where do you get vitamin E? Vegetable oils, nuts, seeds, and fortified cereals. Again, I personally will always tell people that the less you eat from a box, the better. So I'm not a strong proponent of cereal. If there's a better way to get your vitamin E, then do it. All right, so eat nuts and seeds to get your vitamin E. All right, vitamin K, super important for blood clotting. You do need some vitamin K. Now, if someone's on blood thinners because they are at risk for blood clotting or they're on anticoagulants, then vitamin K is not something that they need to take temporarily, right? But you do need vitamin K if, like, let's say your platelets are low and you're bleeding, right? So vitamin K is going to assist in blood clotting, all right? The requirements is that your intestinal bacteria will synthesize menaquinone. A constant supply is normally available to support the body needs, but you do need to have a healthy gut. If you have a healthy gut, then no problem. If you don't, then vitamin K absorption might be an issue. All right, if you have a deficiency in vitamin K, this can be a deficiency that is secondary to other issues. Infants can routinely actually receive vitamin K injections at birth to prevent hemorrhaging, just FYI side note. Now, toxicity with vitamin K is rare. The food sources, again, if you're eating your good green leafy vegetables, you're good to go. And how many Americans are eating any vegetables? And this is why a lot of Americans are vitamin deficient yet overweight, because they're eating the wrong foods. All right, moving on. So the fat-soluble vitamins are going to, like, for example, here you can see this fat-soluble vitamin, vitamin K, assisting in blood clotting. And this is why vitamin K is helping this whole clotting process. It's called a clotting cascade. There's an intrinsic and extrinsic clotting pathway. You may have learned it in AMP2. I'm not going to go over it here because we're doing nutrition, but you can go back to anatomy and physiology and, you know, brush up on that if you took it. And if you haven't, then just watch a video if you're interested on understanding the blood clotting cascade, intrinsic and extrinsic pathways. All right, so I'm going to skip through the case studies because that's not my purpose here. I'm just trying to do a cursory review of all the vitamins. Now let's go over vitamin C. For some reason, if someone is a smoker, they need more vitamin C. There's a lot of reasons for it. Suffice to say, they are going to be deficient. Smokers are going to be deficient in vitamin C. It causes tissue bleeding, susceptibility to bone fractures, poor wound healing. This is why smokers have poor wound healing. It suppresses the osteoblastic activity for bone formation. Bleeding gums, heavy smokers can even have tooth loss. And of course, someone with vitamin C, a child who is malnourished, is going to have what's called scurvy. That doesn't mean that an adult can't have it from like 2-pack-a-day smokers or something like that, right? Now, can you get toxicity? You would have to take over 2,000 milligrams per day. I will tell you this, people do increase their vitamin C intake during the winter flu season. It does help, but I will tell you that it will increase your urine output. It does make you urinate more. Food sources of vitamin C, if you don't want to take the supplements, you can eat more fruits, citrus fruits especially. Tomatoes, for sure, berries like blueberries, blackberries, raspberries, kiwi. If you eat bell peppers, greens such as yellow vegetables, all of these are excellent vitamin C sources. All right, what else is great is that it's highly soluble in water. It is unstable in an alkaline medium, and make sure you don't heat up any of these vegetables or else you lose the vitamin activity. This is what happens with a lack of vitamin C. They smokers can lose their teeth just like this. They literally uproot the teeth and they just fall out. All right. Now B1, vitamin B1. This is very important in the metabolic reactions that increase your ATP activity. A deficiency can cause what's called beriberi. Toxicity, there's no evidence of any toxicity. You could go ahead and go to town with vitamin B1, it's fine. The food sources, yeast, pork, believe it or not, pork, enriched grains, legumes, these are some of the sources. You're probably better off just getting it as a vitamin. All right, next one, vitamin B2, also known as riboflavin or riboflavin, however you want to pronounce it. Food sources, almonds, great to take. Milk, unless you're milk lactose intolerant. Excuse me. Enriched grains, certain meats. Of course, light will destroy vitamin B2. So why is it important? Because it is involved with metabolism and metabolic reactions. All right. So if you want to optimize your metabolism, your best bet is to make sure you get enough B2. B3, niacin. Now, niacin is known to cause flush skin when you take a high dosage. Toxicity will cause reddish flush in the skin, burning and tingling and itching. And that's if you take above the 35 milligram is the upper limit. Why do we do it? Niacin is great for steroid hormone synthesis. That is super important for all the hormones to function optimally in your body. Someone who's menopausal, this is a good thing. DNA repair, this is a wonderful vitamin, niacin. If it's too low, you may have a poor appetite, weakness, indigestion, skin and nervous system disorders, and is known as pellagra. This is what pellagra looks like. All right, B6, paradoxine. What is paradoxine or B6 for? Helps in protein metabolism. What use is all the protein if you're not getting enough B6? You need cell reactions that are involving amino acids, neurotransmitter synthesis, making the proper neurotransmitters so you have a healthy nervous system. Super important. So B6, very important. If you have a deficiency, it will cause abnormal central nervous system dysfunction, microcytic hypochromic anemias. Too large of a dose can cause uncoordinated movement and even nerve damage, but that's if you're taking over 100 milligrams a day. Where do you get it? Again, grains, enriched cereals, liver, if you eat liver, kidney and other meats, legumes, and again, sensitive to light and alkaline situation. All right, next one is folate, super important in DNA synthesis, cell division, glycine synthesis, the reduction of blood homocysteine concentration, and indirectly, it is involved with gene expression. The requirement daily dose is different. For women that need to, that are pregnant need more, okay, for that nervous system development of the fetus. So it can cause birth defects if you're not taking enough. So also poor growth in children if they're not getting enough folate. Depression and neuropathy is also a side effect of low folate. So toxicity of folic acid can mask vitamin B12 deficiency. So you wouldn't even know that you would have a B12 deficiency if you're taking too much folic acid. So interesting little interaction there between the two vitamins. Now, food source is going to be green leafy vegetables, orange juice, and legumes and chicken liver, all of those. Now, again, it'll be destroyed by heat. So eat those green leafy vegetables crude. All right, and this is what a nervous system malformation of the spinal cord occurs with the improper intake of folate. So that's pretty much what happens. Spinal bifida and other kind of nervous system. In this case, the spinal cord is herniating out, and as you can see, the deformity is visible. All right, B12 is next. B12, very common issue with the elderly. So, and why is the B12 an issue? Because of poor absorption in IBS that may occur as young as in your 30s. So age is an issue. Now, vitamin B12, if you have poor absorption, can cause visible fatigue, anemia, anorexia, nausea, neurologic symptoms, digestive manifestations. So vitamin B12 is super important, and you may need actual B12 shots. Toxicity, there's no known toxicity from oral intake, but of course, if you're taking it orally and you have poor absorption, you may need the B12 shots. How do you get B12? Eat beef liver, lean meat, clams, oysters, herring, crab. So if you're a vegetarian or vegan, you're out of luck. So you may need to take vitamin B12 supplements. All right, so I'm going to skip through this and go right into the less popular or less well-known vitamins. I'm going to skip through case studies and go on to pantothenic acid. This is less known, but it is involved in cellular metabolism, acetylation of proteins, and you require about 4 to 7 milligrams per day. If it's too low, the synthetic individuals are fed synthetic diets that contain virtually no pantothenic acid. And so only then you will notice that there's a deficiency. There's no known toxicity with over intake of pantothenic acid. Now, where do you get it from? Animal tissue, whole grains, cereals, sunflower seeds, interesting, milk, eggs, some vegetables, and it is stable to acid and heat, but sensitive to an alkaline environment. Biotin. So you can see that when you read shampoo bottles. What is biotin? Well, it's a coenzyme, really. And as a coenzyme, it'll assist other enzymes like carboxylase enzymes. So it functions as a coenzyme for 5 carboxylase enzymes. All right. Now, the requirement is micrograms. So really, there's no known toxicity. And where do you find it? Cooked egg yolk, liver, soy flour, cereals, meats, tomatoes, yeast. And all I can say is tomatoes, antioxidant. Tomatoes are amazing. Eat tomatoes. Trust me, tomatoes are healthy. All right. Choline. So ever heard of acetylcholine? Well, acetylcholine is going to assist in muscle contractions. So choline is kind of important. And so it maintains also the structural integrity of cell membranes. And of course, as I mentioned, neurotransmission deficiency due to, you're only going to have deficiency if you're on long-term parenteral nutrition devoid of choline. All right. Toxicity, you can have low blood pressure. You can have a fishy body odor. Sounds nasty. Sweating, excessive salivation, and reduced growth rate. All right, so where do you get it? soybean products, eggs, liver, other meat products, and it is stable and it is water soluble, so that's good. Now, plant nutrients, I want to go over quickly. You can do antioxidants and anti-inflammatory benefit from phytochemicals. It can benefit your hormone actions, interactions with enzymes, DNA replication, and it has antibacterial effects. There's no established toxicity. You could take as much as you want. So how do you get phytochemicals? You're going to get them through all the fruits and vegetables that you want, all the legumes, nuts, seeds, whole grains, and certain vegetable oils. So go to town with that, and you're going to kill 3, 4, 5 birds with one stone. So eat your fruits and vegetables, as your mama says. All right, so nutrient supplementation. Why do I actually promote this? Because sometimes we do not get enough from our diet, okay? So the recommendations of nutrient supplementation is dependent on what your age is, what your life cycle situation is, what's your hormone level. Are you in menopause? Are you premenopausal? Are you pregnant? Are you a smoker? Do you exercise? What's your lifestyle? All right, things like that. All right, so that's pretty much it. When you do supplementation, please read the labels carefully. Vitamins can be harmful in large amounts, as I have shown you. Always consult with your physician, and always, if you're going to start doing supplements, get a professional involved. Nurses are somewhat, you're taking this one course. Are you going to be proficient in it? Probably not, unless you do extra certifications. And you can. Maybe you become a nurse, and maybe you're super interested in holistic world and the vitamin world, and maybe you do a certification and become a nutritionist as well. All right, but a licensed dietitian is who you want to talk to or refer the patient to if it's one of your patients. Food is still the best source, but again, if there's issues with absorption, or they can't eat certain foods, or they're vegan and maybe they're just not getting enough of the B's in there, they may need B12 shots. All right, okay. Mega doses, super bad. You can create illness. So balance is everything. Excessive doses will result in toxic effects. Functional foods, super important. Again, don't eat from a box. Try to eat fresh fruits and vegetables. And of course, as you saw, fish, liver, oil, all kinds of good stuff is found in animal fat, but you have to pick the right meat. All right, I hope you enjoyed this presentation. My next presentation will be on minerals, and that'll be a second YouTube. So I do hope you enjoyed this presentation, and I will talk to you all later. Bye.